So reminding folks that we are taking questions via Twitter, via the question box in the web internet interface for GoToMeeting. As well, we can work with the operator to unmute people's lines. Operator, could you give instruction for folks who would like to ask a verbal question here today in the next few minutes?
Certainly, Ms. Dan, thank you. If you would like to ask a question over the audio line, please press *1 on your touch-tone phone. You'll then be prompted to record your first and last name. Please do check that your phone is unmuted before you record your name. If you decide to withdraw your request, pressing *2 will withdraw your line from queue. Again, press *1 and record your name at the prompt. Thank you.
Great. So as we let folks think a little bit more about their questions, I wanted to respond to a question that came in early on in our webinar. Someone asked if there is a way to identify those SAMHSA grantees that Dr. Davis was mentioning, the TCE HIV grantees, as well as the MIA COC grantees. I think I did a quick web search and I found a listing of the grantees from October 2017 for the new TCE HIV grant. And so I would say that yes, some astute Googling will get you the list because those are federal grants and they are announced generally on federal websites. And so that information should be available. However, if you're having trouble and you really need to find a grantee in your area, please reach out to me. My contact information is given out a little bit later on the final slides. I also wanted to point out that HHS has done work with CDC, HRSA, and SAMHSA because grantees of those organizations can request to use federal funds for certain aspects of syringe services programs. Once that request is received by CDC, then it is acceptable to use federal funds to support some of those comprehensive syringe services programs, the type that, as Kip mentioned, might be really helpful for people who are not quite ready for medication-assisted therapy or other stages beyond that, but really just need to start to get engaged in prevention, in counseling, and all of the other services that we like to see provided along with syringe service programs. So I want to remind folks that if you have identified that the opioid epidemic and infectious diseases are impacting your jurisdiction, please consider what funds may be available to use a little more flexibly than they have been in the past. And again, please give us, drop me a line if you need more help finding that information. I understand that CDC is quite timely in the review of the request to determine need, and we'll be following up with folks who submit that online pretty quickly. That's been a really smooth process, and I want to give credit to CDC for all of their work to make sure that that process is smooth for folks in the field who are grappling with some of these really, really challenging problems that require some new approaches. Had a question for Kip. In Maryland, you referenced a plan that you're implementing, I think, related to your infectious disease response. Is there a name for the Maryland plan that you're working on, and or a place where they can find more information on, maybe on the Maryland website or a program website?
It would be great to have that person just reach out to me directly so I can better understand the question and answer it.
Okay. So we can follow up with the Maryland plan question, person who had that question, and get connected with you directly, Kip. Thank you. I had another question here. I want to check in with the operator to see if anyone has raised their hands for the verbal question.
Yes, we do have one participant. Would you like that question now?
That would be great.
Thank
Thanks.
you. Yvette Miller, American Red Cross, your line is open.
Hi, good afternoon. I want to know what is the role of PrEP, Truvada, in treatment and supportive services for this opioid situation. Thank you.
Thank you very much. So my understanding is that PrEP may be an option for people who are at high risk for HIV infection. That would be individuals who are potentially being exposed to HIV through unprotected sex, as well as potentially through injecting behaviors or use of unsterile injecting equipment. My specialty is viral hepatitis, so it would probably be better for me to defer a final answer on the use of PrEP specifically among people who are at risk of HIV through injecting drugs. However, my understanding is that PrEP is also useful in that population. And so we'll take a little closer look at that for future, and we'll definitely clarify. But I don't know if other folks on the phone, any of the other speakers, would like to weigh in on the use of PrEP, or if that's something that you encourage in the local syringe service programs and the comprehensive programs that you're coordinating or encouraging in the jurisdictions you work with. Any of the speakers have a PrEP example that you can share for the opioid epidemic?
Yeah. Hi, Karina. This is Joan from Indiana, and yes, we encourage our syringe services programs that have healthcare providers to offer PrEP and also post-exposure prophylaxis for those with an exposure to HIV who are not currently on PrEP. And our syringe exchange programs are encouraged to offer counseling to clients for both PrEP and PEP.
Thanks, Joan.
Mm-hmm.
Similarly, in Maryland, we're standing up PrEP clinics as we stand up syringe services programs, and we do make our syringe services programs have a way to offer PrEP to their clients as well. They might be ready for that. They may not be ready for everything, but the more services you can co-locate, the better off you are and the more engagement you're fostering with some sort of healthcare system.
Great. Thanks. I guess I'd like to take the one last question that we've gotten so far, and that is for folks, I guess probably the local folks who presented today. Can you describe a little further any efforts that you've been engaged with on expanding hepatitis C screening and treatment access in your states with community health centers or with other partners that have worked, been effective in expanding Hep C screening and treatment?
Hi, Karina. This is Joan again. Yeah, we have a hepatitis C testing initiative that we have offered to multiple local health departments that have traditionally had higher than state average incidence of hepatitis C. And now at the School of Public Health, where I'm actually on faculty, we have just started offering a hepatitis C echo, and we have engaged primary care providers in underserved communities to participate and to begin to learn how to treat patients with hepatitis C. And we're working closely with our state Medicaid office to make sure that those providers have access to prior authorization there's a protocol that says if you're participating in an ECHO project as a primary care provider, you can prescribe hepatitis C treatment to patients. So, as I said, we just started that January 18th, and it's going well so far. So we're very hopeful that we'll expand the access to treatment landscape.
Thanks, Joan. So with that, we are coming up at the end of this session. So next slide, please. Wanted to encourage everyone who joined us today to sign up, register for the Hidden Casualties webinars Part 2, which will be health policy perspectives. We'll be hearing from the Infectious Disease Society of America, NASTAD, the National Association of Community Health Centers, as well as the National Viral Hepatitis Roundtable. Very excited about that upcoming webinar and hope that you will join us for that webinar in 2 weeks' time, same station. Next slide, please. Also, after the webinar, please look for the email containing a link to complete the evaluation. We very much value your input on all aspects of our webinars, and we'll use that feedback to improve how we present information and the work that we do moving forward. So please take a few minutes and return the evaluation when you get that email. Last slide. I think we are done for the this session. I do want to thank the speakers who did just an outstanding job today, providing us an overview. I think it really speaks to the comprehensive approach that that we see is really needed, to the fact that everyone has a role to play as we work to respond the best that we can to this opioid epidemic. And just want to note that, as Rich mentioned at the beginning, this is an evolving epidemic, and we do see some emerging trends like infectious diseases and other trends that are concerning, and I think we'll be thinking about how the opioid response needs to evolve over the coming months and years. Hopefully, within that time, we'll also be able to turn around the opioid epidemic and start to see some real change. I want to thank the audience for your interest and for participating today. We are constantly looking for opportunities and examples, so please don't hesitate to reach out and let us know what you're doing to address the intersection of the opioid epidemic and infectious diseases. With that, please remember that you can always follow up catch up with us and see what we're doing at hhs.gov/hepatitis. We've got blogs, we've got resources, and follow us at HHS_viralhep. Thank you so much and have a great evening.
Produced by the U.S. Department of Health and Human Services at taxpayer expense.